Good morning, everybody. Welcome to our vlog this morning. It's a little bit past, it's 10 past 11, so I'm a bit sorry that I'm late. It's not like me, as you know. My name's Dr. Brooklyn Storme, and I'm the director and the head psychologist here at All Psyched Up. And as promised, what we're going to do today is have a quick discussion around some ways that anxiety can be assessed. And as you can appreciate, it's not an easy thing to sort of navigate at all. So I thought what I'd do today is begin by talking you through a couple of the assessments that you're probably going to be used to if you've been assessed by your GP. So the first one, I'm just going to jump straight into it. The first one that we're going to look at today is called the DASS. So I'm just going to turn the camera around for you and I'm going to show you what it looks like. Okay, so as you can see here, it is called the DASS21, and DASS21 just means that we're looking at the letter D for depression, A for anxiety, S for stress, and here S is score or scale, and 21 because there's 21 statements. So this is a really handy instrument for doctors to use when they're with their patients because it's quite quick to administer and it gives us a general indication of what's going on with the patient at the time. So all we need to do is, oh, hey Karen, how are you going? Good morning. Hi Desley, how are you? So it just asks the patient to read over each statement, and what you're going to do is circle 0, 1, 2 or 3 to indicate how much that statement applied to you just over the past week. So not thinking about how you felt last year or a few months ago, just we want to get a snapshot of your present symptoms. And it emphasises here that there are no right or wrong answers and not to overthink it. So 0 means that this statement didn't apply to you at all. 1 is it applied to you to some degree or some of the time. 2 is it applied to you to a considerable degree or a good part of the time. And 3 is it applied to you very much or most of the time. So as you can see here, hey Renee, how you going? We're just talking about an assessment measure this morning. So what you can see here is we're going to just scroll down. The very first statement says, I found it hard to wind down. So you circle the appropriate 0, 1, 2 or 3. Some people don't understand what this means, but winding down just means relaxing. This question here, I was aware of dryness of my mouth. So sometimes that can be due to medication if you're already taking some medicine. But what we're really looking for here is to try and identify whether or not there's a sign or symptom that might be associated or attributed to anxiety or stress. So it only takes a minute to do these questions, and then what happens is we get a score. So your doctor's just going to add everything up, and we're going to get a score for each of the depression, anxiety and stress measures. So I'm just scrolling down here, and you can have a look at this yourself. It's readily available online. This is in the public domain because it's available for public use. So you can see here, imagine that we got a score for depression of 13. Well, we just go to the depression column here and we go to 13. And we look over here and we can see that a score of 13 would be mild symptoms of depression. If we had a score of, 16 for anxiety, we just pop over to the anxiety column. We look down, we can see that anything that's in between 15 and 19 would be falling in the severe range. And stress, let's say we had 16 again. So stress over here would pop up as mild. So this tool is really handy in terms of giving your doctor an indication of where you're at the moment in terms of your functioning. So it's not going to be used to diagnose anxiety or depression. Hey Karen, hey Amelia, how you going? All that we're doing is just getting a snapshot of your symptoms right now. So that's one measure that your doctor will normally use before he or she prepares a referral for you to a psychologist under what's called a GP mental health care plan. You don't need a referral from your doctor to see a psychologist at all. You only need one if you want to get your rebate. But if you're with a private health fund, they'll give you a rebate anyway. So that's that one. That's called the DASS. The other one that you might be asked to complete from time to time is called the K10. Here you go. Here, just have a quick look. So I've just got this from the, I'm on the internet at the moment while I'm talking to you, and I've just gone into the Black Dog Institute. So I know most of you are familiar with them, but if you're not, it's just a website that's got a whole bunch of really helpful resources and information for mental health. So the K10 just stands for the Kessler Distress Scale 10. So all we do here is just kind of like the DASS. Hey Shani, good morning, how you going? What you can see is we're going to be answering a whole bunch of questions. We've got an extra little measure in here, which is a little of the time. So we've got none, a little, some, most of the time, and all of the time. And the other difference between this and the DASS is this is giving us a picture of how you've been over the past 4 weeks. So the DASS was looking at over the past week. So you can see here we've got, good morning Peter, we're just talking about anxiety measures today. So if we scroll down, we're just going to tick the box really for those statements. There's the 10. So this is looking for anxiety and depression symptoms again. All we're doing then is we're just going to add it up. So it's using the 5-value response option, which as I showed you there was none, a little of the time, most of the time, some of the time, all of the time. The maximum score you can get on the K10 is 50. And the way this one works, good morning Sasha, how are you? The way this one works is that the higher the score, the higher the indication of severe distress that that person might be experiencing. So again, this one only takes a few minutes, and it's just a really handy tool for your doctor to use to get a picture of how you've been tracking over the last month or so. So normally doctors will get you to fill this stuff out prior to completing plans, but a good doctor will also get you to do it periodically just so we can track, measure and monitor how you're going with your symptoms at any particular time. Now, both the DASS21 and the K10 are available in the public domain. Do feel free to go and have a look at them. I'll just turn the camera around again. Do feel free to go and have a look at them. But of course, like with anything, probably not a great idea to be jumping online and trying to diagnose yourself. As I said, these measures aren't diagnostics. They're not going to say you have anxiety or depression or you don't. They're just going to give your practitioner some flags and some clues about what might be worthwhile investigating. So these two tests have stood the test of time, and they have empirical validation, which is something that good scientists look for in all of their tools and measures. So if you're at home and you want to track yourself, that can be a really useful activity to do as well, as long as you're consistent with it. So maybe you just want to track your own moods, you know, every Monday morning for 4 Mondays or 8 Mondays and just compare and contrast and see how you're going. It can be a really useful way to measure your responses as well to things like changes to medication and stuff like that. So anyway, I hope you found that a little bit interesting and useful. If you have any questions about assessments for anxiety or depression, just let me know, because I'm most happy to help. If anybody has a question now, I'd be most happy to answer it. No questions? Okay, well, in that case, I will let you go. Thank you very much for joining me today. Please remember, we've got Brad doing a talk this evening at 6:30 here at Quest on Nepean Highway in Frankston, at number 435 Nepean Highway in Frankston, on hypnotherapy. So it's going to be really lots of fun, and it's free. It doesn't cost you anything. Come down, meet the team, meet Brad, say good day, and we're happy to answer any questions you might have about hypnotherapy as well. So very nice to see you. Thank you so much for your company this morning, everybody. Have a gorgeous day. And yeah, I'm all psyched up about seeing you on Tuesday next week at 11 for our next vlog. Okay, bye.